Thank you. Welcome back to Senate Education, Tuesday, February 7th, 2:35. Committee, last year, maybe it was the year before, but it was last year, we passed Act 67, the community, was it the year before? The year before, thank you. Community Schools Grant. And I can just speak from some personal experience. Years ago, a school in my district, Molly Stark Elementary School, had wraparound services. And to some degree, they still have some of those services. But back at one point, they had a dental chair right at the school. They had, a physician. You could really get the services that you needed. Kid could get the services that they needed. And I think parents could, in some ways, also access some of those services. And as we're looking to see how can we improve education in Vermont, one of the things that keeps coming back to us are things like school nutrition, making sure you don't have a toothache, making sure that mental health is being taken care of, all of those things. So I asked Dr. Boucher to come in and talk a little bit about the Community Schools Grant Program that we passed, where things are, what schools are benefiting from this, how schools got to getting these grants, how many applications, that sort of thing. We did it as a pilot, and these were federal funds, and eager to learn where things stand. So with that, welcome.
Sure, thank you. For the record, Heather Boucher, Deputy Secretary for the Agency of Education, and I am very pleased to be here in person. It's wonderful to see you all. I really enjoy testifying in person much more than virtually, so I'm glad we have that option now.
It's amazing the difference it makes.
It really is. It really is. I was going to start with a funny joke about my name, which I guess I'll do. Not that this is a non-serious affair, but the reason I actually seem very snooty and use Heather A. Boucher is because there actually is another Heather Boucher, PhD, who happens to be an economist and is in the Biden administration. Earlier in my career, her doctoral institution tried to give me an award for her. And I had to tell them, I'm not that person. Yes, you are. No, I'm really not. I didn't go to the new school for my PhD. I know that I went to University of Denver.
Well, we actually invited the person from the Biden administration today. So you're not.
Oh my God.
You were not she? Okay. No, all right. So now I got it. All right,
Yeah.
all right. It's fine. While you're here.
Isn't it funny how it is not a typical name at all?
It isn't. No,
it is
it's
not.
true. It's true. To get it all also.
Yeah. So.
Well, we're glad you were with us.
Thank you, and I'm really glad to be here. So I thought, I hope you had a chance to, I think Senator Hashim, if I'm pronouncing that correctly, I see that you were able to take a look at, or at least get it. I sent it a little bit late this morning. So I had prepared a PowerPoint, and I will just walk you through kind of a high level
Thank you.
Conceptual description of what this program is all about. I'll give you some updates as Mr. Chair asked, and then I certainly am open for any and all questions. So I thought it would be best, I don't know if we have actually come in yet and talked about education recovery domains and how we actually had set that up. So these are how we conceptualize education recovery resulting from where do we go after experiencing the pandemic. So it's really critical for us when we're actually talking about what largely our ESSER funds are funding. And so those are the federal dollars that back a lot of our state level initiatives. And I think Mr. Chair, has Jill come in yet to give an overview of ESSER?
She has.
Okay,
Yeah, she
so
did give an overview.
great.
Yes.
So the distinction between the LEA, the local education agency, which is the districts, and then the SEA, which is the state education agency, and the set aside that we have, some of which is mandated, some of which is more discretionary. So the three domains that we really focused on in terms of our recovery plan are academic achievement. And we like to think of that more colloquially as unfinished learning. There was some discussion a couple of years ago about, when you talk about a lack of learning, you talk about learning loss, it's really, really tough for kids to hear that. It's tough for parents. So let's talk about that it's unfinished learning. Probably, we needed to recalibrate what we were trying to learn and how we were going to do that. Social emotional learning and wellness, social emotional learning, SEL. I'm trying to help you with the education speak here and the acronyms, because we've been talking about it in terms of social emotional learning and wellness. If you hear us in education, the agency say so, that's what that means. So that's one's really quite interesting. So I thought I'd make sure that I note that for you. And then also student and family engagement. So we crafted those through a variety of stakeholder engagement exercises. It kept holding up time and time again that those were the three buckets we wanted to really focus on in terms of how we were going to deploy our federal COVID dollars. So one of the initiatives that was identified in Act 67, as Mr. Chair pointed out, was community schools. And so I'm going to walk you through, Mr. Chair did a really nice job of teeing me up for what are community schools. And then I'll tell you a little bit more about what it looks like in Vermont as a result of this funding opportunity. So community schools are both the place, so a hub, a place in the community, and they're also partnerships. So they're also how is that school and the folks that work in that school building sustainable partnerships in the community, all to ensure that kids have what they need to do well in school, but also that they have nutrition, they have health, all kinds of things. They have extended learning opportunities. That's another big piece. So these are just some different conceptualizations that have been put forth in this space. As I said, community hubs, learning, service provision, community engagement, and then a big core piece is equity for all learners, because as Mr. Chair pointed out, citing Molly Stark School as an exemplar, an early exemplar in Vermont, often the communities that need these kinds of models the most are those that are the most underserved, that have the most challenges in terms of nutrition, typically some of our more high poverty areas, more and more in Vermont, I would say, areas that have challenges in the community with drug addiction, those kinds of issues going on. So in Vermont, we actually adopted 5 pillars consistent with national literature on how to think about what are the core pieces embedded in a community schools model. So you have integrated student supports, and those can be anything from supports for student learning, so the traditional academic learning that we think of, supports for social emotional learning, supports for mental health and wellness, supports for medical wellness. Dentistry is often a really common theme in community schools, and offering that, particularly for families, of course, who don't have transportation. So we know that they're getting their children to school, and that can be where their children then get medical and dental services. And then how are all of those integrated together? So really at the core of the community school idea is something else called the whole child concept. And you can see that from what I'm talking about, which is it isn't just, I like to say, it isn't thinking about, which no one does, but thinking about students as little, brains on feet. This is really about thinking of them as whole human beings and how we actually make sure that they have everything they need in order to effectively learn. Very often we talk about expanded or enriched learning opportunities. So nationally, there is, through the federal government, some funds available that really aligns community schools very nicely with after school 21C funding. It makes sense because 21C funding is, it's really, 21C funding is for the same types of schools I'm going to talk about in a sec. To be served. And then also it is kind of that link between after, what happens when the school day, the traditional school day is over and students are getting ready to enter into their community, whether that's home or after, another kind of experience. So it makes a lot of sense that they're aligned together. Active family and community engagement is a critical pillar. It's really the reason that community schools tend to look unique and different from each other is that they are, because they're really taking into consideration what the particular community they're set up needs. And so they're really, those that are doing it best are actually engaging in active family communication, family collaboration. They're inviting in families that in more traditional settings are not usually, they don't feel welcome to school board meetings or to different kinds of school events. So that's a really big piece that the most effective community schools do. Collaborative leadership and practices, and we're going to talk a little bit about what that looks like, specific to Act 67. And then again, equity, and how do we make sure that schools are safe, they're inclusive for all of our students, so that all of our students, no matter their background, their language, all kinds of ways to think about our wonderful diversity in our student body. So how do we make sure that all students are actually learning effectively and supported? Should I go through the entire thing, Mr. Chair, or pause for questions?
This committee is great. If questions pop up, and we'll go up.
Perfect. Thanks. Great. So Act 67 indicated kind of a corollary to what I'd already said about the communities that we're trying to serve with community schools. So the eligibility criteria that we used here in Vermont were that the student body of the school that was going to receive grant funds had to have at least 40% of the students eligible for free or reduced lunch. Or they had to be identified for what we call comprehensive or equity support. And that's language that's from our federal education plan. So it has to do with, you've probably heard of something called title schools. So that's really what that kind of means. So these are schools that have qualified through our accountability process at the state level to need and will get additional supports for students. Questions on that? So we really, I think that's important because we really did try to narrow, in partnership, of course, with the General Assembly, we really did try to narrow this funding opportunity to those districts, LEAs, and schools that really had high need. So the total fund was about $3.4 million. These were ARP ESSER funds, which was from the third tranche of funding that you're probably quite familiar with now. There are 3 years of funding, so they will end fiscal year 24. So not much time left. We're about 2/3 of the way through, a little bit more than that. And so they'll end officially the end of the fiscal year, and then there's usually about 3 months where the funds can still retroactively pay for things that had already been encumbered. So we have one more academic year is what I'm saying, one more. So that's where I come up with 1.5, and we're kind of halfway there. Makes sense?
Yeah.
Okay. So there were 5 awards. I believe we had 6 applicants, and one of the applicants did not follow the directions. I'd have to go back and look at why. So there was something missing in the application. I'd have to go back and look at that.
Just out of curiosity.
Yeah.
Who was the 6th?
I'd have to go back and
Oh,
look.
okay.
Yeah, I don't have that information. So
Did you help recognize for school? I mean, one of my concerns was I noticed that there were a number of schools that I thought should get these dollars that didn't get these dollars. And sometimes I worry that those schools in those districts don't have the resources to be writing grants, et cetera. And I remember Secretary French sitting here
Yeah.
and us saying, I bet you could identify, Mr. Secretary, those schools that need this the most. And would you say this reflects the schools that need this the most, or are these the gang that has the wherewithal to put together a good application?
I think these schools represent some of our most needy regions. All of them, no.
Okay.
And I think we did certainly reach out to schools that met the criteria that were specified in the law. As you'll see, we've provided significant supports directly to the schools once they've been allotted the funds. I don't know if you'll recall, Mr. Chair, but I actually didn't think we'd get any applications because of the timing of this.
Okay.
So I was
I
thrilled.
vaguely do remember.
Yeah,
that.
because this was during the first year of COVID,
Right.
second year, excuse me. And so I was thinking from everything that I've been hearing that we wouldn't get any applications. And so we did, and we were pretty excited about that. I do believe North Country, the superintendent at that time, John Castle, had come in strong support of this funding opportunity, and his district was awarded the funds to serve all 12 of their schools in that Northeast Kingdom district. So it's always a challenge. We tried also to make this application easy peasy, like it wasn't, superfluous pages of text and those kinds of things. So we really were trying to pay attention to that. We still have to follow grant procedures, and just like we have to follow procurement procedures aligned with but we did have some, where we could have some flexibility in terms of the ease of the application, which we did. We actually took advantage of that.
So, and I know you'll get to some of this, but so people receive their funds, they start to follow the plans that they put forward in the application. One of the concerns, and I'd say complaints 2 years ago, was, okay, limited funding, these schools get a few years to do this, money is going to disappear. Are there going to be, one thing I guess I'm wondering, will you all have lessons learned from this process where you'll come out and say, all right, this is feasible in other schools, but with this cost, that kind of thing?
Yeah, I think so. We actually, and I'll talk a little bit in just a sec, we do have, compared to our other grant programs, this one has a much more high touch in terms of the grantees. And so we meet with them quarterly, with every single grantee quarterly, and we have 2 annual meetings where we bring all of the grantees together, and we host some work to kind of think about common themes and what they've garnered themselves from this process. And so I think we could easily, and we usually do, share in our final report some of those pieces. I think the idea of, the fiscal cliff is something that's on everyone's mind, and it's certainly on our mind. It's also the fiscal cliff in this case being all of those federal dollars and what happens to the programs that we funded. So I think we will need to continue trying to figure out if we're going to invest funding, where we invest those, because this has been a really huge influx of funding for our tiny little state, the bulk of which is at the local level. So I think I'm hearing much more about the challenge of, at the local level, this money's going away. So how are we going to keep these folks on that we?
It ends in fiscal year 24.
Yes.
That means the program, how long do they have before they have to have the money spent? Did you find that any of these schools didn't have a plan?
Oh no, they all did have a plan.
Okay.
Yep. And they're all on track for spending their money.
Okay.
Yep.
So it has to be spent by the end of fiscal year 24?
It has to be encumbered by the end of fiscal year. So there is with most federal grants, there's about a 90-day period where if you've encumbered, which means you have a contract, you have something, you've already set it, you've made an official plan for the money, then they'll allow you to they'll allow you to keep the money for 3 months to fund that.
Do you think that there are schools that don't have a plan? They have needs, but they haven't sat down and actually planned. If some a dump of money came in, that they would be prepared in the future to do this.
Well, I think not of these schools, because that's the beauty of having to go through even a simplified grant process. Like, it requires them to have to sit and think about this. I think the scenario that you're talking about, Senator Williams, is perhaps more in line with what happened when the local dollars from ESSER were just suddenly needing to be thought about, planned for, developed, and then spent. And so I think we tried very hard as a state to have all LEAs do needs assessments and to really guide them on what are you going to do with these funds. I think it's still ongoing. And I'm going to show you a little bit about what the local funds looks like at the very end of the presentation. So one of the things I wanted to note is in terms of what the funds were used for, in some sense, this won't be surprising to you if you understand the concept of community schools. One of the things that is really neat, though, about Act 67 is it required that schools who got these grants hired a community schools coordinator. So they had to hire a person or assign a person, recast a person if it was someone who was already there, to actually be the lead at that local level, to really ensure that these partnerships are happening, to really ensure that the services are being set up for students. Is that the correct time?
Yeah, but you're fine.
Okay.
You're good.
Sure?
We're going
Okay.
to make some shifts. This is important.
So I'm happy to report that all of them, which I think is really important, all of them have actually hired their community coordinator at this point, and that person is working. And that's really important because a lot of what's been happening with ESSER funds at the local level is a real difficulty in hiring for positions, as I'm sure you've already heard. And so they have been able to all hire their community coordinators, which I think is great.
And each one will have a community coordinator, and that's required.
Yes, that was required in our state law. Yep. So I'm just going to kind of run through these, but so some of the themes of what the funds were used for: after school, building internship CTE opportunities that were more community based for students. Enhancing effective wraparound supports for students, including telehealth, which in some of our rural areas has really been required to really meet need. In North Country, they actually built a budget using these funds to provide emergency food, clothing, hygiene items for all students in need. And they also have a lot of students experiencing homelessness, there are many more students experiencing homelessness throughout our state as a result of COVID. They also, North Country did some interesting things, as well as one of the others, I think, perhaps Virgins. I'd have to go back and look at the exact school, and I apologize for that. But they actually did a multi-generational focus where they actually were working with parents to get parents exposed to financial literacy, to their own education, and how to actually improve that. So that's actually really critical and important too. Again, this is really trying to address student need. And we know that for students, a lot of the pieces or the reasons that they are in need is that their families are in need. And so it's really trying to get at that multi-generational perspective. And then I know in White River Junction that part of what they did was establish 10 partnerships with local mental and dental health providers down there to really ensure that all of their students in the middle school were getting their physical health needs met.
You say mental health also?
Yes, mental and dental.
So that's just something that, well, a couple things. We've started taking some testimony on trauma, on mental health in schools. This is a huge, huge issue. This is one way to start to look at it. There are others. One thing that I'm just wondering, and actually it might be my colleagues who are in health and welfare might be able to weigh in on this, is where are we with telemental health? I met with a constituent this weekend. She happens to be a high school senior. She's off in college. Can she continue to work with the same counselor, get financially get reimbursed, even though she might be going out of state? What if you're in the kingdom, but the counselor that works best for you happens to be in Wyndham County? Do we have?
Yeah, I think those are all really great questions. So what I can say about what we're doing with mental health is we also had a grant, Act 127, that provided grants to LEAs and other partners that allowed them to really beef up mental health supports and other supports for students. I mentioned that a little here. I'm happy to come back and talk about that. Telehealth is definitely, like I already said, and like we were talking about, Mr. Chair, something that I have seen LEAs themselves and engage in contracts with. In terms of the state's purview over telehealth, I'm not really sure. I mean, I think that's going to fall back on insurance and
Right.
how health insurance and how health insurance allows or doesn't allow providers to be, providing services.
Yeah.
So
Yeah.
happy to look into it and come
Well,
back.
also, I know that I think the House is starting it. I don't know if Health and Welfare, have you started it? Any conversations around that yet?
No, it's just been touched on peripherally.
Okay. But it was compelling this weekend to hear of a young woman who's gonna probably go to college in Massachusetts. And she has a relationship with this particular therapist. It's not easy always to get a good relationship right out the door with the therapist. It takes a little while. So how can people maintain that and also allow their insurance to continue to reimburse the family?
And really what we're talking about are a bunch of different systems needing to connect and talk to each other. Because if the student is going to go to a college, a university, if she's going to be on their health insurance, which often happens for students, then who knows? I mean, like they might require that they use their providers.
Right.
So it's a very important topic. I just don't know when it comes to across state boundaries. I don't know what we can do as a state, in particular, when we're talking about not only even in the education system, but potentially insurance. That's not my wheelhouse.
I'll just add the other piece that was compelling for me is a lot of people will talk about that personal relationship with their therapist in the room, but this young woman really made me realize that there are a lot of people who develop a really great relationship on Zoom also,
Yeah.
And they feel more comfortable sitting in their home at their dinner table or in their room talking to a therapist. And so that there's some real opportunities there.
I think if that we can find a way for it to be continued, I mean, it's going to be better for the student in that case. So
Yeah.
let us know how we can help, for sure.
Yeah.
I then give you an example. It looks terrible on my handout because it's not color of, this is from Cabot School. Just an example of some of the programming they're running, just to give you a flavor of, this is their after school schedule. So this was, I believe, a brand new after school opportunity for students that hadn't been available, I believe, before this funding. I also received some information from the Virgins Elementary School. This was a late breaking edition. I'm happy to, I'll pass this around. This is from that school principal, I believe, or possibly their community school coordinator on all the things they're doing in Virgins Elementary School. I literally received it as I was exiting the door to come over here. So thought I would just print it and bring it.
Yeah.
Would you say that, or do you know that these after-school programs are directly funded by this initiative?
They should, yeah, they should be. So I believe that this is a new after-school program that was actually, these funds were used to underwrite the new program. Yeah.
Yes, so I was going to have a question about the 5 pillars for Act 67. And, my question was around definitions, because, these things all sound great, but then I always wonder, what do they really mean? And so this document here, so all the schools are required to provide a response.
They were in the
describing-
application.
Okay,
yes.
awesome. That's great.
So they're very familiar with the 5 pillars. That's how they really set up their applications to actually address each of those 5 pillars.
That's awesome.
Some of them did more and some than others, but they had to address all 5 of them.
Thank you.
Sure.
Yeah, just 2 quick comments. One is, we're all concerned about our per pupil number and the amount of money we're spending on education and that. And yet, when you look at this and you see the expansive programs that we are providing to families and students, especially those in need, it's pretty astounding and just pretty incredible. And I also just wanted to bring up a point, which I'm sure a lot of folks aren't clued into, which is that to do really serious, like substantive outreach and community engagement can also be something that costs money. I know where I live, we have a lot of folks who live in poverty, and we decided that it's really not fair to ask them to engage in the evenings, for example, without some kind of recompense, because that might be a period of time when they kind of need to be working to make money to provide for their family. So whether it be food, childcare, or actual money, that is one way to really expand who we get at the table. And it's worked really well, but it is an added expenditure.
So you have that expenditure, you have in what district?
We do that in Burlington. Yeah.
So for example, if a family member, somebody, because of all these circumstances you just mentioned, needs to, or everybody wants that person at a meeting, they might get paid to be at that meeting.
Yeah, yeah. When we have some groups, community, I can't remember the name of the group, but something like a student community engagement group that meets once every couple months in the evenings. And it's made up primarily of New American families. And we usually provide some food and some kind of a stipend. And same with, we have some really great student groups that meet in the summer, and they also get a stipend for engaging in that work. So
I know some of the schools up in the kingdom as well offer laundry.
I've heard that too.
So they offer, they have washers and dryers for families to at the school. So, and it gets them to come in and,
Yeah.
you know, there's no shame in it, or there's reduced shame, and a pantry, food pantry. Yeah.
There's something I've heard about having that food pantry right at place of work, whether it's a pantry or a store.
Mhm.
But being able to leave and pick things up as you leave and make it, like you're saying, very normalized.
Yeah.
Mom said, you need to pick up this on their way home out of school, and they just happen to have it there, and it's reduced cost, and we'll keep it open to everybody.
Yeah.
I think
Really
when
interesting.
you put that in their new school design, like I think they built that into their new construction. Yeah,
Some kind of store.
Yeah.
Yeah.
very cool.
So I'm almost done. I just wanted to end with, not community schools, but just tee up, or at least let the committee members know about other related initiatives, one of which I've already referenced, that are funded through the three, primarily the second and the third tranche of state set aside ESSER dollars. So in terms of mental health, this was Act 127 of last session. So $2.5 million for another set of LEA grants, in addition to these community school grants that are for specifically related to building sustainable mental health supports. Happy to come back in and talk about those. They're not the same. They're not exactly the same schools. So I think that would be unique and interesting for the committee to hear about. We are currently in the process of identifying a vendor to provide supports for educators in terms of mental health. So this was also part of 127. And I can't talk too much about that because we are literally reviewing bids. So
Just a quick question for the universal school meals. I know last year, the price tag, I think, was 29 million, and the forecasted price tag is 24 million. I was wondering what the 8.4 is referring to, or what?
this is universal after school. This is not universal.
Oh, wow, okay, all
Meals.
right.
It's okay.
Maybe I have.
Senator
It's a
Hudson, I
lot.
did the same thing.
It's a lot.
Okay.
It's all universal, and it's like, it goes
Yeah,
right
it's
through
on
it.
All right,
Yeah.
disregard.
Yeah.
Thanks.
And we have invested a lot in after school. So we invested, more than $10 million with our ESSER funds in after school. And the idea is that we're building a universal system of after school around the whole state. And I'm happy also to come back in and talk about that initiative. We partner with Vermont After School and a bunch of other state agencies on that. The set aside mandatory amounts are interesting. So these are of our state set aside amounts. So these are the SEA dollars that were provided. We were required to actually spend these two buckets of money on 2.8 million for after school, which is where I leaped from the 8.4 to over 10 million, because we had to actually spend 2.8, which we found out later after we already started investing in after school, by the way, which is okay. Like, we're all excited about, but that came later because there was a lot, it was a very dynamic situation going on in terms of rules from the US Department of Education and all those kinds of things. So we were obligated to spend 2.8 on grants to LEAs for after school, ideally linked with 21C programs. So it really meant to expand that. And then also summer learning loss interventions, another 2.8 million. And the last slide I have, which if you have not seen this, I think that you might find it very interesting. And I bet Jill already told you about it, which is we actually have a dashboard that you can look at to tell you what the ESSER funds at the local level are being spent on.
She did take us through this.
Yeah.
Terrific.
Yeah, and so interestingly, I thought this is just the overall state. So it's the overall state depiction of what the LEAs are spending their money on. Does that make sense?
Mhm.
So I was just walking you through what the state was spending its set asides on throughout this whole presentation. And so, you know, I think not surprisingly, 47% is on instruction and academic supports. We would expect that. SEL and mental health supports is only 4%. And so that was a little disappointing, I'm going to say, to me when I saw that, because we know that it is a critical factor in terms of students' recovery. Maybe what's happening though is that we have provided supports from a state level. And so at the local level, they might be relying on those, and that's a good thing. So more to come in terms of that. And then of course, physical safety, operations administration are also key pieces there. So I just wanted to show that, and you can go, we have that link for you if you would like it again, and you can go look at your own district or your own region and see what they have planned to and are currently spending their ESSER dollars on.
Senator Twila.
Thank you very much, Secretary Boucher. The, for example, HVAC updates, would that fall into physical health and safety, or would that be under operation? Where would that fall in this?
It would probably be under the physical health and safety,
Okay,
which is why that one's so big,
That's what I
because
was wondering.
those are expensive.
yes,
given-
they are.
Well, and given, you know, where we are as in terms of our housing student stock. It's the same principle. So our school stock, we have old schools. That's really what I'm trying to say out.
Thank you.
You know, the federal government, the state has invested a lot of money in COVID recovery. And I'm wondering what other things should we be thinking about? We know that schools are doing after school programs, hiring more mental health professionals, getting family engagement officers. I know you're coming back in to talk to us tomorrow about a few things. Maybe we could continue that conversation around what else should we be thinking about as we work on our bills to get out this year. I think what I've heard from some local schools is they are very worried when this money ends. There's a lot of recoveries happen, a lot of good things, but it's going to likely, in some cases, come to a screeching halt unless we figure out, are there ways maybe that the state continues investments in those high needs areas, and what would that look like?
Well, right, because we know one option would be that they build these costs into their local school budgets, but we also know that there will be variability in terms of the success of that as an endeavor, because in some areas that will be voted up and be fine, and in other areas it would not pass muster through the voting process. So I do think it's something we need to continue thinking about. As I'm sure Jill shared, we don't have any more money in ESSER. It's all been allocated. So those funds, you know, we're now going to have to be looking, if we do work in that space, it's going to have to be, you know, state funds. So but we're happy to keep talking about that and brainstorming.
Always curious about metrics. So does the agency track some metrics related to these benefits, just looking over the package, increased CTE seats or, lifting, essentially lifting students out of poverty, long range. Some of these, this money packages, this is all very recent, but it's a long-term effort. I'm just curious if there's data on dollars in the programs resulting in, the real goal.
So we actually, yes, Senator Weeks, we actually have, as our recovery plan, we have a set of metrics that we'll be tracking and that's going to be a multi-year effort as we look for an initial bump in the indicators that we've set to look at. A combination of academic outcomes, but also to the extent that we can capture mental health and social emotional learning outcomes for students, for instance. We have strong partnerships in all of these endeavors across agencies within our government. And so we're often sharing information back and forth, if not individually to each other. The planning has been shared. So for instance, we've been partnering with AHS on a lot of those metrics because the metrics for mental health for students would come from AHS services.
So are there dashboards available for this type of?
We don't have a dashboard
Something
yet,
to that.
but we have a plan in place for how we'll actually track progress and track to make sure that there is a return on the investment. And I'd be happy to come back in and present that part of our recovery plan for Senator.
I think that would be interesting.
Secretary French could.
Even what is the opportunities to learn a lot from this are huge. What's 10 years out look like? Are there a way to track kids? Are there ways to sort of see what some of these investments, how they made a difference? So our schedule's filling up, but we could probably find some time next week, a little bit to maybe, or the week after to have this conversation. It's not, pressing.
And 90% of the funds, I want to say, are at the local level. So what we've tried to do is actually require those kinds of indicators. We're doing it as well at the state level, but the bulk of the dollars that are spent are at the local level. And so
But these
with
dollars
each
that we're talking about right now, the wraparound are agency dollars.
the community schools
Yeah.
grants, yes, those
Yeah.
were part of our set aside.
Right.
And as a matter of just the way we always do grants and contracts, we always have indicators of success we're looking at. So we can go back. I think that Senator Weeks, you had a broader question about not just this particular program, but about
That's correct.
in general. So
I think I know I'm stating the obvious probably to everyone here, but if there's one thing that we've learned this year, it is the mental crisis, mental illness, not only the fact that it's deadly, but it's also extremely costly in so many realms. And I hope at some point we can shift the conversation to prevention and wellness. I worry. I just find this all very troubling and worrying. And what is our role on the education committee and as educators and folks working in the field to help long-term fix this problem? I'm so worried for our children.
and a problem in terms of some of our indicators of wellness or functioning for our students, that they were actually, even before COVID, not going in the right direction.
Right.
So much more anxiety, both non-clinical and clinical levels of anxiety. We know that, we have subgroups of students that are at very high risk for suicidality, and whether it's ideation and thinking about that or actually carrying it through. So we would be very happy to, education has to be a part of how you actually come together as a community and as a state to actually solve these
Pulling it into curriculum and sort of like, wrapping it up in what we teach and how we teach and all of those things. Obviously, family is important in this, and home life, etc. But what is our role there?
I think one of the challenges, back to Mr. Chair, your question is, we really have significant workforce challenges in every sector. And so it really does stymie our ability to actually invest in the way that we know we need to. So I think that is one of the challenges that's happening with the unused dollars at the local level is they're trying desperately to hire folks and they just can't find them. And you're seeing that in all other kinds of sectors as well, not just education.
But I just want to follow up also on Senator Jewett's point was, we're hearing later, I think this week from physical and health educators, how do you teach health in a way that, like you're saying, gets kids, I don't know, prepares them to deal with everything that you're talking about. So it's more of a preventative piece, but that's only one tiny piece.
Yeah.
It's just,
Yeah, when I was teaching, I started talking a lot about the brain and the teenage brain. I
Yeah.
was working with teenagers and I found it to be really helpful. And the kids were really excited to learn about themselves in that way because a lot of times, they don't know why they're feeling what they're feeling.
That's interesting.
And
Or the
it's
30
super-
things they're feeling.
Yeah, exactly. It's super empowering for them to know, like, this is what's happening physiologically
Mhm.
in my body and my brain.
Mhm.
So that kind of stuff, I just hope really, gets enmeshed in our curricula at some point.
That's a great point. I mean, to really understand, well, of course I'm feeling this way. This is where I'm at. And yeah.
Yeah, like
Be very helpful, yeah.
normalizing
Yeah.
that, my specialty areas in adolescent development, so it's near to my heart, but, it's, they, in many ways, they revert back to being, I like to say, a toddler in terms of their emotional up and down, but with much more advanced cognitive skills in terms of they can out-argue most parents. So that can actually be very, very confusing for the kiddos, the teens going through that, because it's kind of like, and there's a flood of like a lot of complex ideas and, abstractions and things like that. So, yeah, good stuff.
Thank you.
All right,
See you tomorrow.
thank you. Yes.
Committee, we're gonna come back in about 7 minutes. We're gonna wrap up with Senator Chittenden's bill, some testimony, and then we've got Marilyn